Now, cancer of the pancreas is a very important cancer. It is not as common as as cancer of the liver, and cancer of the pancreas is not particularly common in Asians, unlike, for example, liver cancer. In fact, it is a bit more common among Western people, but nevertheless, it is a very important cancer. Right? So this is jaundice. This is a patient with jaundice, right? When the patient has jaundice, the skin turns yellow. The whites of the eye also turn yellow. And there are medical causes and there are surgical causes. The medical causes of jaundice will be a failing liver, a liver that's failing because it is advanced fatty liver, or because of uncontrolled hepatitis B or C, or because the patient has taken some Chinese herbs or some other kinds of herbs and the liver is going into failure. So those are called medical causes of jaundice. So for liver failure that cannot be reversed, the only way to save the patient is a liver transplantation. But there are also surgical causes of jaundice. And surgical causes of jaundice is when the bile flow from the liver is blocked and can be reversed only by a surgical procedure. So let me explain to you what I mean by bile flow is blocked. Now, this is a very confusing concept for many patients, especially Chinese-speaking patients, because in Chinese, the word for bile, tan, is also the word for gallbladder, which is also tan. And it's also the word for how brave you are, tan. So patients are very worried. If I take away my gallbladder, I have no more bile because no more tan already, and my courage also goes down south. So they are not quite the same. To begin with, bile is not something that's produced in the gallbladder, contrary to what a lot of people think because it's the same word in Chinese. Bile is something that's produced in the liver. And from the liver, it flows down the bile duct, and halfway down the bile duct, it gets stored in the gallbladder, right? Which is why when you have the gallbladder develop stones and so on, the doctor can take away the gallbladder and you still have bile. And the bile will still flow down, and flow down passing through the head of the pancreas into the small intestine, the duodenum, where the bile helps you to digest food, right? So if there's a blockage of the flow of bile anywhere along the bile duct, then you will get jaundice, which is termed as surgical jaundice. Jaundice that is not happening because the liver is failing. Jaundice that's happening because the bile cannot go down into the intestine and it's blocked. And because of that, the blocked bile goes back into the liver and refluxes back into the bloodstream. That's why you get yellowing of the eye and the skin and so on. Of course, it can be blocked by a bile duct cancer here, for example. Then of course, surgery will have to be done to remove that. Bile duct cancers are more uncommon. It can be blocked by a stone here, of course, or a stricture in which a surgeon can go in and operate and remove it. And of course, it can be also blocked by a cancer that arises from the pancreas. And this is the pancreas coming in, and this is the duodenum, which is the beginning of the small intestine. And you can see how the pancreatic duct and the bile duct opens together into the duodenum, right? Just to revise again where exactly the pancreas is. So this is the liver, this is the stomach. The pancreas is actually hidden behind the stomach, right? So if you remove the stomach, then you can see where the pancreas is. The pancreas is here, and this is the duodenum. This duodenum, of course, is joined to the stomach. The stomach continues, food goes into the stomach, then goes into the duodenum, and the duodenum goes around the head of the pancreas before it joins the rest of the small intestine. So the pancreas is snugly tucked into what we call the C-loop of the duodenum. And as you can see, it is somewhere that is involving a lot of vital structures. So you will understand that, of course, if the bile duct goes through the head of the pancreas, and the cancer now develops in the head of the pancreas, then the cancer will obviously block the bile duct. And this is one very important cause of jaundice. So cancer of the pancreas must always come to mind. But in any case, once you have jaundice, you should see a specialist as soon as possible. If the cancer in the pancreas is in the head of the pancreas, as I've just shown, then the patient will get jaundice because the cancer will block the bile duct very early. However, if the pancreas cancer is in the body and the tail of the pancreas, and what do I mean by the body and the tail of the pancreas? If it is arising from here, say the body, or the tail, then really it doesn't block the bile duct at all. And in fact, the patient may not get jaundice or will not get jaundice, and the patient will present with a mass in the abdomen, and they tend to present more advanced because the jaundice is actually a very good early sign of the cancer of the pancreas. One common feature of cancers of the pancreas is very significant pain, back pain, pain going to the patient's back. Because if you recall, the pancreas is behind the stomach, is really towards the back of the patient. And severe back pain is one of the signs of cancer of the pancreas. And this back is middle of the back, not the lower part of the back. And many patients with pancreas cancer has loss of appetite and also loss of weight. How do we diagnose cancer of the pancreas? Patient present either with jaundice or patient present with a mass in the tummy. We can do a scope called an ERCP, and you can see this one in this ER scope. We pass the catheter up and we show up the bile duct, and we can see that the bottom part of the bile duct cannot be shown up. So something is growing here. So this is where the cancer is. Of course, we can also do a CT scan, and this CT scan shows a very dilated bile duct with the pancreas at the head of the pancreas. So we can diagnose with a scope, we can diagnose with CT scan or MRI or PET scan. What are the risk factors for cancers of the pancreas? Now, unlike cancers of the liver, the risk factors are actually not clearly proven. So we don't have such clear risk factors. Cancer of the pancreas has been associated with smoking and has been associated with certain kinds of chemicals. Artificial sweeteners have been implicated in causing cancers of the pancreas, although it's not been proven. So the exact causation factors is actually not clear. It is seen in older patients more often in men and women. So this is adenocarcinoma, which is the most common kind of pancreas cancer. There is also another kind of pancreas cancer, which is more rare, called neuroendocrine cancers. These are more rare and they are slightly less aggressive, but the treatment will be the same as the surgery that's required will be the same as for the adenocarcinoma of the pancreas, which is the more common variety. How do you treat them? The best treatment for pancreas cancer is surgery, but unfortunately, less than 30% of patients with cancer of the pancreas can undergo surgery because when they are diagnosed, the cancer is already too advanced for surgery. But surgery should be done whenever possible, and this is very complicated surgery, and it's important that it's done by a specialized surgery team. And after surgery, it's important to have chemotherapy. If there's no surgery, the survival can be very short. Increasingly, we now recognize that for many patients, it is also important to do what we call neoadjuvant chemotherapy. That means to say that we should do chemotherapy before we do the surgery, because a lot of studies have shown that if we do neoadjuvant chemotherapy, it prolongs the patient's survival after surgery. So the patient has neoadjuvant chemotherapy before surgery, then has surgery, and after that, then have another course of chemotherapy, because this has been shown to give the patients the best or the longest survival. In a large proportion of patients, surgery is not possible. And in these patients, they should be treated with a combination of chemotherapy and radiation. So while surgery is important, surgery is really quite massive because, as I've explained before, the pancreas is actually behind the stomach, right? And if you want to do surgery for cancer in the head pancreas, a lot of things have to be removed. So this you can see here, this surgery has been done to remove cancer at the head of pancreas. A large part of the stomach has been removed, and of course within that is also the duodenum, and you can see that in this surgical specimen that I've done for the patient, the pancreas head is here, and this is the bile duct, and this is the gallbladder, right? And see, once you've done that, you see a lot of things have been taken away. So in this patient, you can see this is half the pancreas left behind. This is the inferior vena cava. The stomach has been stapled off, the gallbladder and the bile duct has been taken. So this is quite a big surgery. That's why you need to be done by a specialized surgical team. Unfortunately, there is no known prevention of cancer of the pancreas. Early detection is not easy. Imaging in the form of scan and MRI can pick up early cancers. And most patients with early cancers are picked up because they have a scan for some other reason, some other indication they have a scan, and because of that, they happen to pick up early stage pancreas cancer. There is a blood test, but the blood test is actually not very specific and not very sensitive, and we don't usually advise them. A lot of patients do a CA99, and then they find that it's elevated, and they come to see us and we do scans, but not all of them will have pancreas cancer. So for pancreas cancer, all cases of jaundice or abdominal pain should be taken very seriously, and investigations should be carried out at specialized hospitals. For cancer of the pancreas, surgery should be carried out whenever possible. And for some patients, neoadjuvant chemotherapy before surgery would be very useful. But whatever it is, once you get jaundice or serious abdominal pain, do not delay. Go and look for specialist help as soon as possible. Okay, thank you very much. I'll be happy to take any other questions in the remaining time. Okay, there's a question from Jason Ong. Does pancreatic cancer affect insulin production? Usually not in the early stages. It doesn't affect insulin production unless you're talking about, and I'm talking about the usual adenocarcinoma of the pancreas. Of course, there are very rare tumors of the pancreas called neuroendocrine tumors. An example of the neuroendocrine tumor, among the neuroendocrine tumor, there's a special type called insulinoma. And these are cancers which are very rare, which can actually cause an increase in the production of insulin. Of course, even the regular cancer in its advanced stage can affect insulin production such that the patient get less insulin produced, and patients can present with diabetes. So that is the short answer to your question. Rahima says that her sister has neuroendocrine cancer. Following surgery, she didn't get any chemo then. No, I will not agree that there is no cure. In fact, for neuroendocrine tumor, the chances of cure is very high. And even if she has secondaries to the liver, they are still very treatable by surgery, by yttrium-90 therapy. So I think unless your sister is very old or very frail, I think there's still a good chance to treat her for her neuroendocrine tumor, right? You should get her to see a specialist. What should one do with a dilated bile duct? Now, dilated bile duct is a very important sign. You should go for further investigation to find out why the bile duct is dilated. You should see a specialist. You may need to do an MRI to make sure that there is no cancer that's blocking the duct, that's causing it to dilate. So a dilated bile duct is a very important thing that has to be investigated. If the pancreas has been removed, what are the disadvantages of having no pancreas? If the pancreas has been removed, the patient will be diabetic because the patient will not be able to produce any insulin. So the patient will have diabetes that has to be treated with insulin. That is the main disadvantage of having no pancreas. But of course, if the surgery is necessary because of cancer, then it's better to do surgery to remove the cancer and then to accept that you have diabetes, but because diabetes can be very easily treated. What is the survival for stage 4 pancreas cancer? That depends on whether the patient responds to the therapy, to the chemotherapy and radiation therapy or not. Generally, survival is not very long, but among those patients that respond to therapy, their survival can be quite significant. So it actually depends on whether the patient responds to the therapy or not. So it's individualized with the patient. Right? Dave says, doing annual CT scan or MRI. Well, annual CT scan or MRI, depending on how young you are. Let's say if you are 30 years old, you do an annual CT scan and you live to be 90 years old, you're talking about many CT scans. So that's a lot of radiation. So we will not advise doing an annual CT scan just for the sake of for screening. MRI has no radiation, but the MRI contrast, which is called gadolinium, collects in the brain. And because of that, we also don't advise yearly MRI unless you've got a very good reason, especially if you're young, because you do MRI every year for a long time, it can be quite dangerous. So TK Tan asks, if the CA99 drops initially after chemo but rises again, can a PET scan and a PET scan done reveals no active tumor? What is the next course of action? I think this is in the context of a patient who has been treated for pancreas cancer. When the CA99 rises, we are of course very vigilant. If the PET scan shows no active tumor, we will continue to follow up the patient until and see whether there's a tumor appearing later. Sometimes the CA99 can be fluctuating, so it doesn't always mean that there's tumor coming back. So you should consult your doctor, right? Okay. Oh, sorry. Yeah. Okay. Yeah, I'm giving a talk. Can I talk to you later? Yeah. Okay. Okay, Veronica says baby used to have jaundice after birth sometimes. Oh, that is neonatal jaundice. Neonatal jaundice can be quite easily treated. It is nothing to do with cancer. So the one not to worry too much here. One with liver cancer and recovers, does he have an increased chance of pancreas cancer? Anybody with a cancer in the body has a higher chance of developing another cancer. So patients who have a history of cancer should be more vigilant, right? What are chemo options after pancreatic surgery? There are two main types of chemo regimen, and you should discuss with the doctor because they are very, very specific and depends on the fitness of the patient, right? What is the lifespan after neoadjuvant chemo and surgery? It also depends on the stage of the cancer. The earlier the stage of the cancer, the longer the survival. So it's not easy to give one figure there, right? Does insulin injection by patient give a higher chance of pancreatic cancer? We don't have any data to show that this is true at the moment, right? What are the likelihood of other members getting liver cancer and colon cancer? If a member of the family has liver cancer, there is a higher chance that the family member can get liver cancer. Colon cancer is quite common, so it is not necessarily true that there's a higher chance of other members of the family getting colon cancer, unless you belong to this particular group called the Lynch syndrome, where the chances of getting colon cancer is very much increased among the other members, right? Blood test for liver alpha fetoprotein above what reading? As long as it's abnormal, you should see a specialist, right? CA99 is not a very useful test for pancreas cancer. You can have a normal CA99 and still have pancreas cancer. On the other hand, your CA99 can be increased and you have no pancreas cancer. So it's not a very good test, right? Okay. So Daniel, the liver study name is called the Elegant Study. You can find it in the website of the NCC, and there is actually an email address for you to write to, and also there is a phone number for you to call in during office hours, right? Somebody asked, Chiu Chun Tan asked, what are the considerations of chemo? The current thinking is that after Whipple's, you should have chemo. Chemo is useful even for early stage the early stage pancreas cancer that is being removed by Whipple's. Right. Pancreatic cyst of 1.6 by 1 cm. It depends on many features. So a good MRI will tell you what are the risks you have, and usually if there are some risks involved, we'll follow up the patient with a repeat MRI every 2 years. If a person is born with jaundice, do they have a risk of getting liver cancer? A person born with jaundice is neonatal jaundice. That one has not related to pancreatic cancer, right? In advanced liver cancer, will pancreas be removed? Yes, the pancreas can be removed and the patient will be diabetic. Then the patient has to be treated with insulin, right? Tai Ching Pan asks if a dilated bile duct has to be removed by surgery. Should the gallbladder be removed? Yes, it should be removed at the same time. Is the metallic taste a side effect of pancreas surgery? Not in all patients, and only in some patients, right? Okay, a patient is initially diagnosed with pancreatobiliary, now diagnosed as carcinoma of unknown primary. That means the surgery has been done or the biopsy has been done, and they don't think is the tumor comes from the pancreatobiliary tract, so it's a cancer from another type. And sometimes it's very difficult to know where the primary cancer is. For Folk Leong Tam, maybe you resend your question again because I don't know where your question is at the moment. For Yong Wai Liu, is pain at the right side? For pancreas cancer, I think you're referring to that. It's usually at the center, not at the side. David Chow asks, is there any other research to detect early stages of pancreas cancer? I'm not aware of such a research project at the moment. Adeline Yap, yeah, the name of the study is the Elegance Study, and you can get that from the NCC website. So please log into that website. Well, Gina will type for you. If you have pancreatitis, is the risk of getting cancer higher? For a patient, for the small proportion of patients with what we call chronic pancreatitis, yes, their chances of getting pancreas cancer is higher. But patients with chronic pancreatitis are actually quite rare. Annual blood check enough to check the health condition? Unfortunately not. There is no annual blood screening that can cover all kinds of conditions, right? So Nelly asked, PET scan and MRI, which is good for liver and pancreas investigation. The first cut should always be an MRI. PET scan is actually not the first line of investigation. It's a supportive investigation. So Folk Leong Tam, if the patient has stage 4 and does not respond to therapy, the survival is less than a year. Of course, for patients that survive with therapy, that respond very well to therapy, then it is individualized for that patient. For patients who doesn't respond, then the survival is very short. Right. Okay, good. So I think we have come to the end of Q&A, right?
Thank you, Prof. Chow. Thank you so much. Thank you.
Pleasure.
Yeah,
So I
thank you
hope
for reading out the
I've
questions.
answered all the questions that.
Yes, you did. Yeah, and I want to thank everyone for your active participation. Okay, so please help us to improve by completing the feedback form. The link will appear immediately when you leave the webinar. We've come to the end of this webinar, and we would like to thank our valued speaker for today, Prof. Pierce Chow, and especially everyone here for spending your Saturday morning with us. We look forward to your support and participation in our future events. Thank you and have a great weekend. Take care and stay safe.